We've worked with Doctors of the World to analyse their service user data to look at the difference between the clients and their social experiences prior to the pandemic and what was going on for them during the pandemic. The first thing we notice is that the number of clients radically reduced when the service, through necessity, had to move to a telephone and online advice service. Less than half the number of consultations per month. It was noticeable that the clients coming to Doctors of the World at this time were reporting high levels of precarity in terms of employment, but also in housing. So far fewer had secure tenancies than they had prior to the pandemic. Large number of pregnant women reported that they'd lost their employment, and many of the people who came to seek services were not in receipt of employment at that time. Another factor that was really noticeable was the increased numbers of asylum seekers attending the service. This, we think, relates to the increase in hotel accommodation that was provided for asylum seekers within London, and their inability to connect with health services because those connections weren't made for them within that form of accommodation. Looking ahead, what we learn from this research is there is a need to provide face-to-face services for the most vulnerable, and a particular need to ensure that asylum seekers can access services such as health services from whatever accommodation they're in. Hotel accommodation isn't sustainable, and certainly we know from experiences of up in Scotland that asylum seekers who've been housed in hotel accommodation are much more likely to experience poor levels of mental health.